positive inotropic agents enhance cardiac contractility and thus increase cardiac output. Although these drugs act by different mechanisms, the inotropic action is the result of an increased cytoplasmic calcium concentration that enhances the contractility of cardiac muscle. The cardiac glycosides are often called digitalis or digitalis glycosides because most of the drugs come from the digitalis foxglove plant. They are a group of chemically similar compounds that can increase the contractility of the heart muscle and therefore are used in treating HF. The digitalis glycosides have a low therapeutic index, with only a small difference between a therapeutic dose and doses that are toxic or even fatal. The most widely used agent is digoxin. Digitoxin is seldom used due to its considerable duration of action. Beta-adrenergic agonists, such as dobutamine and dopamine, improve cardiac performance by causing positive inotropic effects and vasodilation. Dobutamine is the most used inotropic agent other than digoxin. Beta-adrenergic agonists lead to an increase in intracellular cyclic adenosine monophosphate, CAMP, which results in the activation of protein kinase. Lastly, milrinone is a phosphodiesterase inhibitor that increases the intracellular concentration of cyclic AMP, CAMP. Like beta-adrenergic agonists, this results in an increase of intracellular calcium and therefore cardiac contractility. Long-term, milrinone therapy may be associated with a substantial increased risk of mortality. So that was all for heart failure drugs. Hope you have a better understanding of the topic. Have a happy and healthy lifestyle and keep learning with sqadia.com.